Good morning. I'd like to welcome, well, good afternoon too. I'd like to welcome everyone to our monthly webinar. Today's webinar is titled, Health is Catching On in Dekalb County. My name is Peter Cribb and I'm the National Director for the CATCH program with the Michael and Susan Dell Center for Healthy Living at the University of Texas School of Public Health, Austin Regional Campus. We are very excited about today's webinar, but before we get started, I would like to take care of a little housekeeping. First of all, our webinar today is being recorded and an archive will be made available on the catchusa.org website, and that will be tomorrow. And that's www.catchusa.org, along with a PDF of the presentation slides. During today's webinar, we encourage you to type in questions and comments via the questions box, which you can access through the control panel on your screen. You can type in your questions at any time, but to keep us on schedule, we'll try to hold off on answering those questions until the Q&A portion at the end of the presentation. When typing in your questions into the questions box, please be sure to select the option to send your message to all the attendees. Next, I'd like to let you know a little bit about the Michael and Susan Dell Center for Healthy Living. We are an international leader in conducting research and providing programs that promote healthy living for children, their families and communities. Our work fosters improved health behaviours among youth, influences policy and environmental change to support healthy living, and advances professional education and community service. Our vision is healthy children in a healthy world. You can find out more about our centre and our work in school health on our website, www.msdcenter.org. Now I'm really delighted to introduce our special guests for today's webinar, Lisa Cummings, Nancy Prang and Christy Mayer. Lisa's been in the healthcare field for over 19 years. Lisa's been part of the KishHealth System for over 7 years, working on the floor as a pediatric registered nurse and also as a community wellness educator. In 2010, Lisa was given the full-time role as a community health liaison for the KishHealth Community Hospital to lead the Dekalb CATCH program to help improve the health of Dekalb County. Nancy Prang is a registered and licensed dietitian. Nancy has 20 years of experience working with all areas of the lifespan. She has worked in the community, in hospitals, as well as in education. Nancy has also worked as a dietetic internship director at Northern Illinois University for about the last 5 years, and with the Dekalb CATCH program for 2 years. Childhood nutrition and wellness have been a natural link for Nancy as she has 4 young girls. Next, I'd like to introduce Christy Mayer. Christy is an elementary school principal in Dekalb, Illinois. In addition to her responsibilities at school, she also chairs the District Wellness Committee and serves on the Live Healthy Dekalb County Board. Through these roles, she has helped to create strong partnerships with NIU, KishHealth Systems and Dekalb Health Departments and the YMCA. Today our guests are going to share their story of how they have cultivated and maintained partnerships across Dekalb County to bring CATCH to the classroom and the community. Good morning and welcome, Lisa, Nancy and Christy. Over to you, Lisa.
Well, good morning. Can everybody hear me well?
Yep.
Okay, good deal. Well, I want to thank all of you for joining us. Sometimes I feel like we eat, breathe, and live CATCH, but we absolutely love it. And so thank you for being a part of us sharing a little bit of, the work that we've been doing in Dekalb County the last couple of years. Slide, please. So I think it's important to hear a little bit about the history of CATCH in Dekalb County and how we started. And so I'll share from the health system perspective, I'll share a little bit about our strategic action plan and why we do that. talk a little bit about the CATCH pilot that really kind of spearheaded this whole initiative at Tyler Elementary School, and then how that, the school district really got interested in presenting to the school board, and then how we proceeded with other schools. Slide, please. As a health system, we have to conduct a community needs assessment every 3 years, and this assessment gives us an idea of the health disparities that we are facing within our county. This last health assessment we did actually with the Dekalb County Health Department, and we use that data to help us drive our initiatives. And it seems like the last couple of times that we've done this, the high priority areas seem to be the same, which all of us know: obesity, cardiovascular disease, high cholesterol, blood pressure, and cancer. And so this then drives our community wellness department and our health system to look at programs and how we can combat those types of health issues. And so when we were looking at obesity, it was part of my role to look at the community and look at ways that maybe we could address obesity in DeKalb County, specifically CATCH. Slide, please. Thank you. So CATCH started with a pretty amazing pilot project at one of our elementary schools in DeKalb, and how it came about was very unique. I was part of a leadership academy that year, and I was new in my role as a community health liaison, and so I had CATCH on my mind all the time, knowing that this was a program that I really wanted to disseminate throughout the county, but wasn't quite sure how I was going to go about that. As part of our leadership academy, you had to do a project with other leaders in your group. And so we had about 27 people in the class, and we had to vote on different types of projects. And so I was talking CATCH and what a great program it was, and it was nationally recognized. And people started listening and saying, you know, we really heard that obesity is a problem in kids. And next thing you know, I had 12 leaders that were going to be a part of this project. And we started thinking about how we were going to implement this, and one of the leaders in the class was actually a principal at Tyler Elementary School, and she came up to me and said, I want you to come to our school. My babies need this, and I want to do the pilot project here. And so we chose to do our pilot project at Tyler. It was one of the highest free and reduced percentage schools, and so she was really excited that we were going to be able to focus specifically on her school. And what was amazing about this is that if you could implement CATCH to its fullest fidelity, it is amazing what it does in terms of just the culture of the school. I was doing classroom lessons because teachers weren't quite ready to be able to do the lessons, so we wanted to model that, what that looked like. So we did pre-K through 5th grade lessons. We did 8 of them throughout the year. So the kids were hearing the lessons while the PE teacher was implementing CATCH PE. And so the kids were hearing the same language: go slow and whoa, moderate vigorous activity, and that would connect back to the classroom. And so, you know, PE was on board with that as well. We worked closely with the food service staff, and actually that year, Christy Meyer and I wrote a grant for fruit and veggie bars, and we were awarded fruit and veggie bars for every one of the elementary schools within the district. And so when you're teaching kids about making healthier choices, you know, the kids sometimes will say to you, I don't have access to that at home, or my mom doesn't buy me those types of foods. And so Christy and I thought it was really important for us to go for this grant so that kids could make that choice there at school and let them know that, you know, they were able to do that. And then lastly, the family component. And so we worked really hard with the school. We had many events throughout the year. We had a Catch the Dance Fever where kids brought in, they received a ticket if they did physical activity, 60 minutes with their family, Monday through Friday, and they were awarded a ticket for the dance. We did field day at the end of the year. Most schools have a field day. Well, we just catchified it. We had different stations with different catch games. We had assemblies at the schools where NIU athletes came in and talked about why it was so important to be healthy. We had food play come in, and they did interactive theater about go slow and low foods, and we had that at some of the elementary schools as well. Next slide. Here are some of our Tyler Catch kiddos. We were very fortunate in that we did not really have funding, but we went to the community and presented to different organizations to fundraise, and we had a lot of support with this project. In fact, we had actually money left over that we were able to buy extra equipment for the school. We purchased t-shirts for the kids, and they just were so excited and so proud that they were trying to make healthier choices, and the word was really getting around town, and it was a buzz. It was really cool. Next slide. So after the Leadership Academy and our pilot project was completed, we were asked to present at the DeKalb School Board, and so our superintendent, Jim Briscoe, was very, very interested in what we had been doing at Tyler Elementary. And so we went and presented to the school board, and they liked what they saw. They wanted to know, what were our next steps? How are we going to expand Catch throughout the community? And that's where we had to think about, okay, sustainability. How are we going to sustain this program with all of these schools? I couldn't be teaching the lessons at all the schools. We know that, the best thing is to have the teachers do it, but we weren't quite there yet. So we piloted Catch at another elementary school, at Cortland Elementary. And at that time then, Tyler was able to sustain Catch at their school with us checking in with them if they needed any resources. Next slide. Okay, now I think this is going to turn over to Christy, and she's going to talk a little bit about the district wellness team and how Catch has really fit in with our wellness vision for the district.
Thank you, Lisa. Good morning, everyone. So I am a principal in the district, and one of my responsibilities, I wanted to be a part of chairing the district wellness team. So several years ago, I took on that role. And the really amazing part of being part of the district wellness team is as we sat around the table with representatives from all over DeKalb County, agencies that have wellness as part of their mission, it really comes to light how many different agencies within our community, and I'm sure your community as well, have health and wellness in their mission and goals that they would like to accomplish. So around the table we have folks from the YMCA, the KishHealth System, the NIU. We have the Ben Gordon, which would be our emotional health, social emotional health. We have PE teachers from the district, social workers from the district, nurses as well from the district. I'm not naming everyone, but certainly I'm hoping that you as participants can think about your own communities and think about the agencies within your community and how they probably have the same goals that you do. And what I realized was we provided, as a district, we provided easier access to the students, the clients that they were looking to get into their doors. So certainly this wellness team was a springboard to all the agencies and community partnerships that would then help with our springboarding our CATCH program throughout all of our schools in DeKalb District 428. As you see there on the slide, you'll see that our wellness team isn't only about fitness and nutrition. We're looking at the whole global needs.
We may have just lost Christy. We're just checking our audio. Christy, are you there? We can't hear you. Lisa, would you be able to jump in here until we regain Christy's audio?
How's that? Can you hear me now?
Yes, got it.
Oh,
Thank
my
you.
goodness. You got me? Can you hear me now? Next slide, please. Thank you. Are we okay?
Thank you.
Okay, very good. Thank you. So, as you see here, we have been working here with CATCH and trying to put CATCH then in all of our elementary schools, which we have successfully done that now for 2 years. But how do we do that? As Nancy had said, we had to look for that sustainability. We had to look to our partners, look to our agencies to help us and get them trained in CATCH in order to bring them into the school. What you're seeing on this particular slide is a way, as Nancy said, to look at not only CATCH in the classroom and CATCH in PE, but to look at ways that we can take CATCH into the home environment as well. And as I think about the participants that are listening today, I think about ways that you can look at each school that you're in your, if I can assume that some of you are in a district, or look at your neighboring district and look at the agencies that might be around, and then how you can partner with them. Then secondly, looking to a leader within that district. Right now in DeKalb District 428, we're very fortunate that we have a superintendent that is fully on board. And it helps to have his leadership in encouraging all the rest of the principals to be on board as well. Now, it may not be a superintendent, maybe it's an assistant superintendent that you can go and see, a person who can sign on as also a wellness champion. I would also recommend something like we have, the structure that we have here in DeKalb District 428, that you take a look at the stakeholders within that district. Is there someone that you could say would be a champion in the area of fitness and wellness? I would suggest that there may be a principal that has that passion, and with that then they can take on that liaison role with the agencies. Everyone may have a different structure, but the most important thing that I have found in our structure is that we have the support of our superintendent, and then we have someone such as, in this case it's me, that serves as a liaison between the community agencies, our partners, and the district. And when we do that, then we can reach out to all our partners when we're having evening events to infuse the CATCH philosophy within those evening events. Here's an example. Tomorrow is our fun fair at Jefferson School. And instead of in the past it was like carnival games, now we've infused some minute-to-win-it type or catch activities within those are the games that the students are earning punches. It's kind of like Chuck E. Cheese's, then they go and redeem prizes. So we're also having a healthy snack demonstration. So we're infusing Catch into evening activities that in the past were more carnival-like. Family events, Family Institute nights. We have Catch topics for parents to access during those times. What you're seeing on your screen right now is our family YMCA night. Our YMCA was gracious to they close their doors on Sunday nights at 6 o'clock, and again for our DeKalb District 428 students, and we arranged for stations within the Y, and at each station they were involved in some sort of catch activity. What you're seeing here is our wonderful partnership with the NIU Nutrition Education, Dietetics Department, and you're seeing here families learning about nutrition at our YMCA Family Night. You may, next slide please. And here are some additional pictures, and this is one of those stations you see where you have children and their parents looking and seeing. This was right before Halloween, and the students were learning about how many mini candy bars, if you eat how many mini candy bars, that equals a large candy bar. And honestly, with surprising numbers, I was surprised at how few mini candy bars equals the caloric intake of a large candy bar. Next slide. And this is what I was emphasizing in regards to our partnerships. You'll see here we have, that's my face for the DeKalb School District, but we also in the DeKalb School District, we have, you know, our PE teachers involved, as well as our around the table at our wellness, the nurses, the social workers, and so forth. NIU, we have several departments at NIU involved, from dietetics to community health to PE health, and at one point we had nursing too. So, and we're looking to broaden that out too to physical, we have PE. We're looking at physical therapy department as well. So Northern has been a great resource. If you don't have a neighboring university or college, certainly there are the agencies that we've pulled from as well that have been so instrumental. Our KishHealth System has been, again, a champion in this area, as well as our Kishwaukee Family YMCA and our Dekalb County Health Department. The Dekalb County Health Department was instrumental in the way that they, besides having our wonderful Nancy LaCurcia from there, but it's also, they have a grant that they wrote that have provided us, the We Choose Health grant, have provided us with some of our funding to support some of our activities, to fill our bins with hands-on activities for the students, models and such, because what we've noticed and learned along the way is how we can further engage our learners in the classroom, and the We Choose Health grant has been instrumental in making that happen. Next slide. I think I am passing it over. Yep.
Yes, so welcome everyone. This is Nancy Crane. I am the NIU, Northern Illinois University liaison, or one of them. And I wanted to sort of share how NIU became a bigger part of this. There, as Lisa had mentioned, as well as Christy, that there were times where different NIU students would come in and do different pieces, but it was mostly just they'd come in one time and do one thing and then move on. So this was sort of where we really made a better connection that was going to be more sustainable. And in 2010, I want to say, when Lisa was doing the different pilot programs at the schools, our dietetic internship was going through a revamping to emphasize more life cycle. And I attended one of the DeKalb Live Healthy DeKalb meetings and met the superintendent, introduced myself, and said that I was interested in seeing how my dietetic interns could do some nutrition education at the schools. And he, as Christy said, is extremely supportive. So about a week later, I emailed him, reintroducing myself and kind of with some bigger ideas and more detailed ideas of what we could do. And literally within 3 minutes, he emailed me back and said, absolutely, this is who you need to talk to with our wellness team. And so he led me to Christy Meyer. So from there, Christy and I, along with one of the PE teachers who is on the wellness committee, met and started talking about how we could do more with my students. And they shared what they had been doing and what Lisa had been doing. And so we brainstormed sort of different ideas and then who else could possibly help us with this. And I felt like I entered at this perfect storm because CATCH was already brewing at some of the schools, and the health department had this grant that we were able to use, and it was the piece of the puzzle that was missing was the workforce. We needed the worker bees, and that's where our students came into play. And as Christy mentioned with the different partnerships, one of the wonderful things about having NIU working with this is we have this endless stream of students coming in that can be engaged with the DeKalb School District. So that has made this program very sustainable. So the first year that we really partnered was the 2012-2013 school year. And to be honest, it was a little bit of a hot mess, at least logistically. We were somewhat flying by the seat of our pants because we kind of initiated it in August when the students came back, the NIU students came back and the DeKalb students came back. So we were really learning as we went. And in that fall, it was dietetic students and nursing students. So nursing students when they were in their community rotation and dietetic students when they were in their life cycle rotation. So they paired up. We had one dietetic student and one nursing student paired up at each school, and they team taught the different CATCH lessons. We were able to do this once a month, so 6 times a year. And Lisa was able to, she was extremely familiar with CATCH, picked out the different lessons that we would be doing, and then we went in and implemented them. We, in the spring, then had public health students, health ed students, and then also KMPE students joining in into the mix. And so we had a lot more workers to be doing this, and different perspectives that they each brought to the table was also really nice. So from that first year, we did learn a lot. And next slide, please. And some of the biggest strengths that we had were that the kids absolutely loved the CATCH lessons in the classroom. There's a new voice that they get from the NIU students coming in. DeKalb is a college town. We are in Husky country. Everybody is a Husky fan, kids included, and so having the NIU students coming into their classrooms is always exciting for them. And on the flip side, the NIU students absolutely love the experience. For my students, and actually for all of the different students, getting into the school setting is not always that easy, so that this provided an opportunity for them to be able to work with this age group and this population, which is an absolute blast. Next slide, please. So here are some pictures of the different students doing CATCH. The first one with the kids sitting down, that's a kindergarten class. And so these are a bunch of 5-year-olds that are sitting there very attentively listening and raising their hands and talking about go and whoa foods, and they were completely engrossed in it. And even though they were at this moment in the lesson, they were completely engaged. We did, you know, the low and slow beverages, the, you know, rethinking your drink, and had the different drink bottles with the sugar in them as displays, which of course the kids loved. And then also within every activity, as you know, with the CATCH program, they're always getting up and moving around, and so the bottom picture, you can see them doing that. Next slide. And then actually these pictures are from actually just our CATCH Day that we just had last month. So you can see that we do have some props in there. The first picture we have the clogged artery model, and that still the students will make different props as well if they feel like there's something that they want to add to the lesson. Next slide. Here's the kids lining up with one of the lessons where they determine the, you know, moderate to vigorous activities, which ones are, you know, is your heart beating slow, and then moving on down the line to which ones make your heart beat faster. The lessons that talk about energy balance, we also did some yoga poses to talk about balance as well, to kind of bring that message home. Next slide. As we've kind of been talking about, one of the biggest strengths is the collaboration and the sharing of resources. No one group could pull this off the way that we have been doing this. It really takes a village. And having the hospital and the health system, having the health department, the Y, NIU, all working together in the school district to really give these kids a great education in how to be healthy and just to live healthy. Next slide, please. Some other fun things that were some strengths is that we did get a lot of exposure in the community through the local newspaper. I pulled a couple of the headlines from there, but Fight to be Fit, expert schools work to educate both kids and parents. Dekalb schools expand health education. And you can see, you know, when these were published. Next slide. I have a few more. The Fight to be Fit was actually a series. So another one in that series was Community Struggle with Issue of Overweight Youth. And then as we started to expand, you know, Kingston Middle School to start CATCH program. We have an article on that. Next slide. And catching on at Genoa Kingston Middle School, and CATCH to start at all Sycamore schools. So as we did start to expand, we got more coverage through the newspaper. That was just a small sample of the different headlines that we have had in the Dekalb Chronicle. I certainly did not pull them all, but I just wanted to show you that the community as a whole is really finding out about what we're doing as well. Of course, we did have lots of challenges that went along with that first year. As I said, we were really learning as we were going, and you know, we started in August, and so you know, we were really trying to prep it even as we were going. So one of the biggest challenges was the lack of educational tools and funding. That first year, we had some grant money, but not a ton. So the lessons for that first year, any visual aids that the NIU students wanted to bring into the classroom, they needed to either make or bring in themselves. So that was certainly a challenge in that not every school would get the same level of lesson because of the different visuals that would go along with it. Another challenge was the lack of classroom teacher and administrative understanding of CATCH components. And certainly Tyler got it and Cortland got it, where Lisa had done the pilot programs. The PE teachers had been doing CATCH PE for a while, so they got it. But the other schools in the district were not as familiar with CATCH, and that was something that we sort of overlooked, that we know CATCH and some of the schools know CATCH and everybody was so excited about CATCH that we sort of overlooked really giving them a training on all of the different components. That they did sort of know CATCH PE, but they didn't quite understand why we were doing CATCH PE in the classrooms. So really we needed to give them some type of training with The scheduling of the NIU students at each of the schools, as I had mentioned, we were doing kind of interdisciplinary teams, and that spring when we had health ed and KMPE and public health and nursing and nutrition students all going out there, the logistics of trying to organize all of those students to be at the different schools. It was a mix of both graduate students and undergraduate students. So undergraduate student schedules are completely different. They may be available in the morning but not in the afternoon, or vice versa. Some of the students were doing this as part of an assignment for one of their classes. Others were just volunteering. So there was certainly a lot of logistics and, kind of a logistical nightmare going into the scheduling piece of that. We made it work, but it did take quite a bit on our end to make that happen. And then the last one is that we needed more on-site support for our CATCH students at the schools. That first year we really looked to the PE teachers to sort of be the mentor to the students, to the NIU students while they were on-site. And this, as excited as they were and as much as they wanted to, they were in class. So Dekalb County has PE every day, so that the PE teachers are very busy. So they didn't necessarily have the time, or they couldn't be available if there were any kind of issues that the NIU students needed. So we really needed to look at how to solve that and have more support for those students when they were in the schools. Next slide, and I am going to turn it back over to Lisa.
So if we were presenting in front of all of you, we would have you up and moving and doing like 0-in or 2x2 fitness. Oh, okay. So revamping the CATCH program. This is the exciting part. Nancy shared a little bit about some of the challenges, and you have to go through those growing pains in order to, improve your program. And so again, it was a perfect storm. It was unbelievable that this We Choose Health grant came through and all of this funding, and we actually had a staff person at the health department that really took charge of, CATCH in terms of bringing it to the community with this new grant. And so we then looked at ways that we were going to improve the program for the next year. One of the things that we did in the summer of 2013 is we had a CATCH Academy for classroom teachers. There were a couple of reasons for that. First, just to get them engaged and invested. Teachers love to talk to each other, and so we really wanted them to know that we were going to go to them to look for ideas, ask them, what are some things to help get, the students more engaged. And so they spent a day with us. We did a training with them, talked what, CATCH is about, the obesity epidemic. We fed them lunch. That came out of the grant, too. Everybody loves to, have lunch. And then we actually brought out some lessons, and we sat with them, and we picked them apart, and we took notes. And Nancy took all those notes back with her, and those helped her in writing and revamping some of the lessons a little bit. The other thing we did was, and Christy was a big part of this, was reconnecting with the district leadership. Again, not everybody was as excited or knowledgeable about CATCH, and so, going in and presenting to them and just revisiting, what is CATCH, why is it important, and why are we doing this at all the elementary schools. And so this past year, we have just seen a complete 360 turn in terms of, principals being on board, teachers knowing, that we're coming in and excited, secretaries at the front desks knowing that the NIU students are going to be there, and so it's a lot more organized just because we revisited that and took that time to, explain again what our mission and our vision was. And then one of the other revamping things that we did was the lesson planning and prioritizing. And so when you have 8 elementary schools and kindergarten through 5th grade at all these classrooms, you really have to plan and prioritize, and Nancy was very instrumental in doing that. Next slide, please. In addition to revamping the CATCH program, with that funding, with We Choose, we were able to really beef up our educational tools for the students. These are college students. They don't have a lot of money, and so we wanted to be able to give them a way to bring CATCH to the classroom in a fun, dynamic way. And so when they went to the lesson, they could go to these bins. It was very organized. They could take the props that they needed, and then they could go straight to the classroom. And so as you can see that picture there, we purchased lots of different things. We purchased artery models, fake food models, My Plate, fat test tubes, sugar test tubes, a lot of things we created as well, and that we did over this last summer. And so we spent a day together creating some, homemade things that the students could use. We also did the NIU CATCH training, so every semester we do a training where we bring in the NIU students and anybody else who's going to volunteer, and they spend 2 to 3 hours with us, and we not only talk about what CATCH is, we talk about the lessons. They actually bring out some of the lessons. They get a chance to look at that, but we also talk about professionalism as well, what they should be wearing, how they introduce themselves to the kids, and Christy comes and she spends some time with those students just sharing the experience as an elementary principal, what they can expect in the classroom, and we always find that the kids, like Nancy said, love having them come in. So that training is very integral. In addition to, after that training, the students have an opportunity a week before the actual lessons in the classroom to go to the NIU teaching lab, and we spend a day there from 9 to 4. They can come in at any time. They can bring their lessons and come in with their partners. We have the educational bins there, and they get to practice. We get to give them feedback, suggestions. It's like a classroom setting there, so they can, get up in front and, pretend like they're presenting. And so we have found that just incorporating that really changed the caliber of presentations that our NIU students were doing in the classroom. The first year, I think some of them weren't as confident. Some of them would read from the paper. By making all of these changes, they're feeling really good when they're going into the classroom, and they're having a blast too. It's really a win-win situation. Another revamping thing we did was we decided that we needed CATCH liaisons at each of the elementary schools. And so we called this group our CATCH cadre, and we have one liaison for each school. Now, some liaisons at the school will actually teach during that day if we're short NIU students, but mostly they're there for support at the school. They make sure that, the students show up. They make sure that every classroom gets their lesson. They can run copies. They go in, they pop their head in to make sure everybody's doing okay or taking pictures. And so that person is there that entire day to be able to support our students that are at that school. We also then incorporated pre- and post-testing the second year, and so we thought that that was important. With all this work that we were doing, we needed to show that we were making a difference. And so we initially thought we were going to do this for all 8 elementary. We actually ended up picking one of our biggest elementary schools, Founders, and using that as a sample. And so we have pre-tested them, and we will be post-testing them at the end of the school year. Next slide, please. So where were we going from here? As we continue to grow, like Christy and Nancy said, we have to think sustainability. CATCH is definitely spreading throughout the county, and so we need to recruit more CATCH instructors. We are looking to go back to nursing, and now that we really have a structured program and way of implementing this, hoping that they'll jump on board again, maybe looking to elementary ed, honor students, physical therapy, like Christy said, and we're actually in conversation with our local community college, and we're meeting with them on Friday, our second meeting, to talk about how their students may be able to be a part of our CATCH initiative as well. And as far as expansion, school districts, they're very competitive, and so we like that when it comes to CATCH because I think some of the districts look to Dekalb as kind of this gold standard, and we have Sycamore School District. Actually, we were there yesterday all day at our first elementary school in that district, and so we had public health students there all day and did CATCH lessons, and Genoa is also jumping on board as well. Next slide. Here's just some pictures. These are my middle schoolers. I actually go in and do the lessons at this time. So you can see we're doing Go Slow and Whoa Foods. The one on the right is 2x2 Fitness. We always do a physical activity. The middle school, we piloted 6th grade. This was through a grant, and they actually would like to include 7th and 8th grade next year as well. So that's always a great thing when you feel it's successful and the administration wants to make that program grow. Next slide. This is Sycamore School District. Again, this was yesterday. This was our first time in that district, and so again, we had public health students doing the lessons. Next slide. All right, and so Nancy's going to continue a little bit more about where we will go from here.
So as we talked about our Catch Academy last summer with our classroom teachers, was definitely a huge success. You could really see that aha moment with them when Lisa went through all the different pieces, that there's the Catch PE, there's the Catch Classroom, there's the Catch Cafeteria, there's the Catch Parents. So all the different pieces coming together, they could really see how incredible this program could be as it continues to grow and expand, and what their role is. And ideally, our goal with the classroom teachers is that these lessons will be so integrated into the curriculum that they will count for minutes, that they will know what lesson is going to be coming up, and because they will be the same 6 lessons each year, so that they will know, okay, well, Catch is going to be coming next week, and they talk about, taking your pulse, and so when I talk about it, I can refer or say next week you'll be doing even more, and so really being able to have that fully integrated into the curriculum. So from there, our next one this summer, we want to have a Catch Academy for the food service. Now, we really won't be able to change the menus at this point, but really we want to be able to highlight all of the go foods that are on the menus, to do more posters, and to talk to the food service to see what their ideas are and how they feel that we could be promoting the go foods and the healthier food options that they do have, and seeing what kind of resources that they need. And then summer 2015, we want to then focus on our parents. We do already have that home school connection happening with our YMCA family fun nights. And then also each month, the Dietech interns write a newsletter article. So in the fall, we do it once a month, so it's one on nutrition and healthy eating, one on physical activity, and then one on decreasing screen time, so that we hit each of the pillars of Catch. And then in the spring we do the same 3 again, but obviously different articles and a different spin on it, but we stick to those same 3 pillars of Catch. So that the parents are becoming familiar with what Go Slow and Whoa means, but we really want to do more education with them, and then really look at the different fundraising that they do, and how can we make that into more of a positive, healthy way. You can see the picture of the parents and the kids doing like a walk-a-thon type of thing. So really trying to instill more of those types of activities and getting away from any of the cookie dough or pizza sales or any of those types of things. And for the most part, I believe the classroom parties and the birthdays, the district has made it pretty healthy on that respect. But sometimes there's pushback with parents on that end, so we're hoping by having this Catch Academy and really listening to what they want and how we can support them, will really build that connection as well. From there, it's on the slide, but we are thinking that then we'll probably go to the PE teachers, because it will have been a while since they've been doing Catch PE, and so looking at how we can support them, and then probably going back to the classroom teachers, because it will have been years since we met with them, and we want to keep revisiting each different area. So they say this may be the first generation of kids that won't outlive their parents. It has taken us 30 years to get to the obesity rates we see today. It will take about the same time to turn things around. CATCH is a tool that can help us accomplish that, and schools are the perfect environment to reach children and their parents. So that is what we have. Any questions?
Hi Nancy, we're running a bit short on time for questions today, so I'm going to encourage folks to email them to me. We've answered already electronically to a couple that have come in with any questions, and I do remind everybody that this webinar will be archived at catchusa.org, and the slide presentations will be available also. I want to just say once again, you know, it continues to amaze me how much people can accomplish, you know, when they work together. And the example you provided today is fantastic. I think using the students as role models for the kids, it's a win-win in both ways for not only your students but for the kids, the teachers, and everybody else in the community. I'd also like to congratulate the Dekalb School District for having daily physical education. That's a thing we don't see too often. So once again, thank you Lisa, Nancy, Christy, and all your partners for the commitment you've made to create and support a healthy environment in your community. Our next webinar will be on March the 19th at 11:30 Central Standard Time, where our guests Steve Becker and Mackenzie Noda from the Jewish Community Centers of North America will share their story of Discover Catch in early childhood at JCCs across the country. That ends our webinar for this month. Thank you all so much for your participation, and once again, thank you Lisa, Nancy and Christy, and we'll take care and we'll talk to you again next month. Bye now.
Thank you.
Thank you.
Thanks.